Hi everyone, my name is Rebecca, and today I will present information to you about pediatric immunizations. So please join me as I share this information. Thank you. Immunization vaccines protect against a variety of diseases, and it's the Center for Disease Control and Prevention that publishes an immunization schedule for vaccinating U.S. children and adults. For this presentation, I will focus on the recommended immunizations for children. This infographic depicts the recommended immunizations for children from birth through 6 years old for the year 2014. And of course, I will go into depth for each one of these given vaccinations that the CDC recommends. Similarly, this infographic gives the recommended immunizations for children from age 7 through 18 years old. And of course, I will further explain each one of these given immunizations in the following slides. In general, hepatitis is the swelling and inflammation of the liver caused by a viral infection. Hepatitis B is usually spread via contact with blood or bodily fluids. 3 doses of the hepatitis B vaccine are recommended. The first dose is at birth, the second between the age of 1 and 2 months, and the third between the age of 6 and 18 months. And hepatitis B vaccine should not be given if a life-threatening allergy to yeast exists. The RV vaccine protects against the rotavirus, which is a common cause of diarrhea in infants and children. Depending on the brand that is used, 2 or 3 doses of the rotavirus vaccine are recommended. In the case of 3 doses, the first dose is given at 2 months. 2 months later, the second dose is given, and 2 months after that, the third dose is given. The RV vaccine should not be used in babies who have had a type of bowel blockage. The Dtap vaccine protects against diphtheria, which is an upper respiratory tract infection, tetanus, which is an infection of the nervous system that causes muscle contractions, and pertussis, which is also known as the whooping cough. There are 6 doses that are recommended between birth and the age of 12 years old. And at the age of 11 or 12 years old, it's actually a booster shot that is administered that is called the Tdap Vaccine. And after that, a booster shot is recommended every 10 years for diphtheria, tetanus, and pertussis. The Hpv vaccine protects against the H. influenzae type V virus. Complications of a viral infection include meningitis, epiglottitis, and pneumonia. And depending on the brand, 3 to 4 doses are recommended for immunization. The PCV vaccine protects against pneumococcus, and complications from a pneumococcus infection include bacteremia, meningitis, and death. There are 4 doses that are recommended for immunization with the PCV vaccine. The Hpv vaccine is the inactive poliovirus vaccine that protects against polio, which is a viral disease that can affect nerves and lead to partial or full paralysis. Just as a side note, FDR had polio. 4 doses are recommended. That last dose given at 4 to 6 years old is a booster shot. The flu vaccine protects against influenza, which is an infection of the nose, throat, and lungs that spreads very easily. Dosing is usually done once a year during flu season, and that runs between October to March of the following year. Now, special consideration is given for children between the age of 6 months and 8 years old who receive the flu vaccine for the first time. And that consideration is that 2 doses are given at least 4 weeks apart for these children receiving the flu shot for the first time. The Mmr vaccine protects against measles, mumps, and rubella. Measles is a highly contagious respiratory disease, which is best known for its typical skin rash. Mumps leads to painful swelling of salivary glands, and rubella causes fever and a rash. And more significantly, birth defects in women who are pregnant, such as deafness, blindness, and heart defects in those unborn babies. 2 doses are recommended. And there is a documented mild side effect of swelling of the glands in the cheek or neck, or even a rash that appears, but it's not very common. The next vaccine we're going to talk about is the one for chickenpox. Interestingly enough, I had the chickenpox growing up. My younger brother and sister never did. And for a while, I used to wonder why. Now I know. The Varicella Vaccine protects against the infamous chickenpox, which causes an itchy rash of blisters all over someone's body. 2 doses are recommended, and the Varicella vaccine is contraindicated for people who have had a life-threatening allergic reaction to gelatin or to the antibiotic neomycin. The Hpv vaccine protects against hepatitis A. Now, we already discussed what hepatitis is. Hepatitis A differs from hepatitis B in that it is spread via direct contact or through contaminated food or water. 2 doses are recommended. The first dose is administered between the ages of 12 and 23 months. And then the second dose is given anywhere from 6 to 18 months after the administration of the first dose. Now we're moving on to the recommended immunizations for children between the ages of 7 and 18 years old. We start out this portion discussing the Tdap Vaccine, tetanus, diphtheria, and pertussis vaccine. Now, this vaccine is actually a booster shot that is given between the ages of 11 and 12 years old for patients who have already completed the Dtap series of vaccinations, diphtheria, tetanus, and pertussis. If a patient has not received the complete Dtap series, or if their vaccination status is unknown, a single dose of the Tdap vaccine can be given between the age of 7 and 10 years old. The Hpv vaccine protects against the human papillomavirus, which is the most common sexually transmitted virus in the United States. 3 doses are recommended. The first one between the ages of 11 and 12 years old. The second dose is given 1 to 2 months after the first dose, and the third dose is given 6 months after the first dose. The Mmr vaccine protects against the leading cause of bacterial meningitis in children, and there are 2 recommended doses given between the ages of 11 and 12, and then a booster that is given at 16 years old. The pneumococcal vaccine is usually given to children between the ages of 6 and 18 years old who have a predisposing medical condition that place them at a higher risk for pneumococcal disease. The following is a list of immunizations that can be given to patients between the age of 7 and 18 years old who perhaps had an incomplete series of vaccinations or who never started their immunization vaccinations and are now trying to catch up. Side effects are always a concern, especially when you think about side effects in kids. Fortunately, for immunization vaccinations, side effects aren't very severe. The most common ones that are encountered are fevers or reactions at the injection site, like soreness, redness, tenderness, and swelling. A word of caution should be noted for individuals who are immunocompromised, as they need to talk to their doctors before getting vaccinated, and also for women who are of childbearing age, as they should consult with a doctor or a healthcare clinic before getting vaccinated. I want to thank all of you for joining me and watching this presentation. I hope you all learned something, and good luck, everyone!